Welcome to Get to the Root, the podcast that's redefining what health benefits should be. I'm your host, Dr. Erica Armstrong, founder and CEO of Root. Here we explore the category we've created, root cause health benefits, a smarter approach that uses advanced lab screening and functional medicine to reverse chronic conditions and lower healthcare costs. Each week, we sit down with forward-thinking employers, innovative brokers, and change makers who are transforming healthcare from the inside out. If you're ready to move beyond sick care and build a healthier future, you're in the right place. Let's get to the root. Welcome back to the Get to the Root podcast. I'm your host, Dr. Erica Armstrong. Today's guest is Dave Chase, the co-founder and CEO of Health Rosetta. Health Rosetta is an organization that is transforming how employers purchase healthcare by focusing on transparency, value, and better outcomes. At Root, we work closely with Health Rosetta-aligned companies who are looking for innovative, cost-effective ways to improve employee health, so this conversation is especially close to home. Dave is a nationally recognized health reformer, author, and speaker, and under his leadership, Health Rosetta has become a blueprint for companies breaking free from the broken status quo. I'm excited to have him here today to talk about where the movement is headed and what to expect at this year's annual RosettaFest, where Root will also be attending, and where some of the most innovative minds in healthcare and company leadership exchange ideas. Welcome, Dave.
Thanks so much for having me. Excited to see you in Denver, and I think one of your clients is winning an award, so that's pretty cool.
Yes, the podcast that aired just before yours, we had Bruce, the CEO of Fastco, and they are winning a Rosie Award. So we're honored to be part of their employee benefits. So Dave, you helped spark a movement around fixing healthcare at the employer level. So first off, what is Health Rosetta, and then what originally inspired the vision behind it?
Yeah, I mean, the way I would sum it up is it is a blueprint. You mentioned that word. And then you have the skilled contractors to take that blueprint and the power tools all in one place to build world-class healthcare plans that literally can cost half as much. And in terms of what inspired me, I mean, there were a number of things, but really the thing that put the wheels in motion, unfortunately, was a friend who was frankly crushed by the healthcare system. She had a similar career path and life path to me, but got the wrong cancer diagnosis. That happens 1 out of 5 times. Of course, that leads to the wrong treatment plan. And in our country, that means financial, physical, emotional devastation, leaving behind a 10-year-old daughter. And I saw that. I'm one who tries to find some purpose and meaning out of tragedy. And it put me on a quest. I kind of joke, I guess maybe I was Indiana Jones, being an archaeologist, digging around for healthcare's Rosetta Stone, like who'd crack this code? Because it was a system problem. It wasn't just like a single doctor or single hospital or something like that. And then I found that. And then now I'm Johnny Appleseed spreading the good word of how to do it. And so that's really at least the high level story behind what got me going on this path.
That is a very powerful reason behind the vision and wanting to translate it, which I was thinking about your name, Health Rosetta, and it's so fitting because there's so much ambiguity in healthcare, and being able to translate all the different languages around it makes a lot of sense for why you named the company.
Yeah. Read a health plan contract. It's worse than Egyptian hieroglyphics.
Exactly. Yes. So what kind of companies do you support now, and what are their reasons for reaching out to you and joining Health Rosetta?
Yeah, I mean, we have all kinds of companies in public and private sector, but I'd say the most common are mid-market employers. We define that pretty broadly, like 50 to 500 or 5,000 employees rather. Oftentimes, their workforce are what during COVID times, we'd call them essential workers. They're like manufacturing, logistics, first responders, and really working middle-class employees of employers. And frankly, those employers wanted to end the 30 years of wage theft that has happened for their workforce, because they might have gotten a pay raise, but all of it and then some was eaten up by healthcare profiteering and price gouging. And they wanted to they buy into what we believe in, which is you can turn healthcare waste into prosperity. And so that's really one of the most common threads. And once they realize that's actually possible.
So how do you support these companies who reach out for these reasons?
Yeah, I shared the metaphor a little bit, but like to make it a little more practical, we have this blueprint that we don't claim to have invented anything. We just discovered it. But then we train and tool up the people that are actually out working with employers, right? So there's people all over the country, variously called insurance agents, benefit brokers, benefit consultants. But at the end of the day, they're the people who take health plans out to 54% of all Americans, about 180 million Americans, get their health care through their job. And so we try to make their life a lot easier to do great work. Because candidly, when I discovered the Rosetta Stone, I also discovered, wow, that's a lot of work. It'll be sometime between the year 3000 and 4000 before this gets to every employer at the rate we're going. So we need to make it easier. And so that's a big part of what we do. There's some technology. There's a lot of know-how in terms of how do you go about contracting with these different organizations and all that contracting stuff. It's probably the most boring thing you could ever imagine is an insurance contract, but it is actually at the root of every dysfunction I've ever seen in healthcare. The way we pay produces the outcomes we want. And so that, of course, can work great. And we see that. But unfortunately, for the most part, it hasn't. It's pretty much produced dystopia for the clinicians, right, who live it every day, and the patients when they're in the system. And frankly, as if it's not bad enough to be sick and deal with cancer, you have misery heaped on top of you. 100 million Americans are in debt to the healthcare system. That is not a bug. That is a feature of our system. And that's why it's got to get replaced.
You explained that so well. And it is one of the root causes. And our name being Root, we are focused on root causes. So that aligns really well. What are the biggest shifts that you're seeing right now among employers who are adopting the Health Rosetta principles?
There was this old line that people bought for a while that, you need to have your employees have skin in the game. And it's just a fancy way of shifting huge cost burdens onto those least able to afford that approach. And so what we're doing is helping them adopt approaches that thousands of times over now. Like, you can't say we got lucky. It's been large companies, small companies, rural, urban, public, private, you name it. And these approaches consistently deliver world-class healthcare, starting with great primary care, by the way. And we see this consistently costing 20 to 50%, like 50, believe it or not. The best health plans are way better than these kind of bygone era plans that candidly were built in an era when acute conditions were the main issue and the greatest generation and boomers were the primary recipients. Today, it's chronic disease, it's mental health, it's 75% of the workforce and millennials and Gen Z. Like, the landscape has changed, but you wouldn't know it looking at some of the old health plans that are out there.
Yes, that is exactly what we're seeing at Root. We've looked at hundreds of thousands of claims actually as more companies are looking to root cause healthcare to address the chronic condition spend. And it's like 75 to 90% of their spend is in chronic conditions. And it's not just in one area, but there are some key areas that we're seeing. It's autoimmune conditions, metabolic conditions, gut health issues, and hormonal imbalances tend to make up the vast majority of what we're seeing. Sometimes there's migraines or the medication costs that are associated with that as well. And so that's really insightful and intuitive that the old way of doing it, covering acute care, is really not moving the needle in overall health. And the fact that, yes, it is all ages now, and we're seeing chronic conditions younger and younger, unfortunately. So how do you see Health Rosetta continuing to evolve with the way that you're working with companies as more and more companies are looking to redesign their health benefits with these new realities?
Yeah, I'll answer that, but I just want to double down on the root cause thing, since that's what we're all about here. You talk about those conditions and what's going on. When you've had 30 years of wage gains stolen, people have no savings, they have no nest egg. Half of Americans are terrified of the healthcare system. And so they have fewer dollars and very little time. People working 2 or 3 jobs. And so guess what happens? You eat this food that's just horrific, right? Far better than me about the health impacts of that kind of not only food, but the stress. I'm relatively well off compared to the average Joe, and the stock market takes a dip and I'll feel some stress. Man, imagine you're one bad stub toe away from financial ruin. That's horrible stress that's making your body go through all the things that lead to the conditions you address. But in terms of the next few years, in the past, we really had to build these health plans from scratch. To be very blunt, we can make the current plans suck less, and we do that. But ultimately, to get the great plans, you have to build it from scratch. So what we're seeing now, though, is there's these kind of proven package solutions. We call them community-owned health plans. They might be focused on a particular geography. They can also be focused on an industry. And they really lower that burden for both the benefits advisor, insurance agent person, and the employer to get that world-class health plan. Because yes, the plans, these world-class plans are way better. If you could put it into a pill, it would be the blockbuster drug of the century in terms of health outcomes because of what enables, like the right kind of care relative to status quo. But the effort has been up there too. And so now, fortunately, that effort has gone down a lot. We need to continue to take it down even more. But like one of the things you'll hear about at RosettaFest is how we're building prepackaged plans around great advanced primary care, functional medicine, root cause, all that type of stuff that I think will be music to your ears. And we want the easy button to be the good stuff, not the bad stuff.
Absolutely. It's music to my ears. And the way that we feel at Root, that healthcare should be designed. So I'm so happy to hear that. I'm excited to learn more at the conference. So it can seem like a daunting shift, especially as healthcare is difficult for companies to even know where to start to change. But I think change often starts with even a mindset shift. And so what do you think is the biggest mindset shift that companies need to make these kind of changes to change their health plans?
I couldn't agree more. I get asked all the time, what's the biggest obstacle? It's mindset shift by far. And most Americans have been indoctrinated into believing that fixing healthcare is like trying to fix Middle East peace. But in reality, it is something that's quite straightforward and in their control if they care about their workforce. Like if they actually believe, you know, what you hear all the time, employees are our most valuable asset, you got the tools. Whether we started doing this type of plan when we had 5 people on our plan. That's not exactly Walmart. We're huge now. We're like 15 people, and we're doing it, right? Built around direct primary care model and then so on, but it's working for unions that have 200,000 members. So that's a big part of it. Is it's just a lot more straightforward to do it each day. And again, you're going to hear more about some of the tools that we're going to release and some of the open source stuff at Health Rosetta. So even if you're not a member of our community, we're giving away resources for free. It's so important to do that.
Oh, wow. That's great. Can you give us a little bit more of a sneak peek into this year's RosettaFest?
Yeah. We mentioned the Rosie Awards earlier, which were recognized as the best employer health plans in America. But also part of that, we're honoring winners in the name of 3 giants that we lost in 2024. There was Tom Emmerich. He came up with a Centers of Excellence program when he was working at a very large employer that's now available to companies like my size. Marshall Allen, great investigative reporter, author. And by the way, Tom Emmerich, that award is for basically healthcare innovation and whatnot. Marshall Allen, we're giving out an award for patient advocacy and how important that is. And then Harris Rosen, behind the Rosen Hotel story, which is an amazing one. I did a TED Talk about them. And what they did was the inspiration for our organization's purpose. We're what's called a public benefit corporation. So it's a for-profit company with a social mission. And then we have this nonprofit called Nautilus Health Institute. So he was a big inspiration there. And so we're really excited about that and the people that are incredibly deserving. I'm also really excited about the next round of these open source resources in this organization called Nautilus Health Institute. So this is basically our secret sauce. And from day one, we felt like if we could make these types of world-class plans much more repeatable, like we talked about earlier, lower that burden, and we could verify that. And if we did it thousands of times, we would have to open source that. if we wanted to impact the whole market. Even if we were way more successful than our wildest dreams, we'll never be remotely close to 100% of the market. And we saw how, like, I came out of tech, and it's funny, I even hear this old expression in healthcare sometimes, particularly with health benefits. Nobody ever got fired for hiring IBM, and they're talking about sticking with the old carriers. And I'm like, you know what? I was there. And it's like, until they did get fired. And then IBM went into this death spiral that they had in kind of the pantheon of corporate turnarounds. Lou Gerstner came in. And then guess what? The most proprietary, closed, controlling organization ever became an advocate for open source. So IBM had their road to Damascus moment. That's the idea here, is let's open source these methods, because that's what actually, if you look at what unseated IBM and then Microsoft, it was open source software. These are very powerful, dominant organizations, not too unlike some of the big healthcare organizations. And so we think there's a new era. We're in an era of transparency and trust. And so the fact that we can give away these resources, it's not like consumer level resources. You still need to know what you're doing, but people are pretty blown away. In fact, the first question, or a question I'll get asked, is, where should I start? And I'll say, you got to work with the right benefits advisor, like Brian Bellware, who's behind the client you were talking about. Pretty hard to get from here to there if you're not working with the right people. So one of the things, actually, the National Alliance of Healthcare Purchaser Coalition CEO, Sean Greminger, asked me a few months ago, hey, do you have something that will help our members? There's about all the employers and all these coalitions that they're an umbrella organization over, reaches about 90 million Americans. He said, do you have something that would help them select a better benefits consultants? Because they're not getting good advice right now. I'm like, yeah, actually, we've had something for 5+ years. We'll open source that. And so that's becoming kind of new market norm. And we're seeing people we've never heard of and companies we've never heard of who are sending this out to people in our community and saying, hey, follow these requirements. And so those types of things that make it a lot easier to build these health plans, it can get pretty wonky pretty quick, but it's really the master key that kind of mixed metaphors cracks that code on the healthcare hieroglyphics. So really excited about how that's going to get in people's hands.
That sounds like a wonderful resource and very noble of you to make that available to truly impact the way healthcare is delivered. So you've seen firsthand what works and what doesn't in employer healthcare. What kind of innovations or partnerships do you think are still missing from the ecosystem?
Yeah, we have great partnerships happening, and that's one of the unique things about RosettaFest is it cuts across. It's got clinicians, it's got employers, it's got the benefits professionals, the solution and tech. That's great. That's really didn't exist before in terms of events, bringing those together. But I think the biggest gap in terms of partnerships right now that's starting to get understood is basically local community civic business leaders, right? That they all of a sudden can realize this incredible opportunity to transform trillions of dollars of waste at a time when data suggests, research suggests that up to 14% of the workforce is going to be negatively impacted by the AI revolution. And so you can either sit there and wait for that, some magic solution to come from DC, but I'll break the news to you. The cavalry's not coming from DC to fix it. It's on us. And so what's great is some of these heads of benefits at a city, a county, a school district, they're really leading the way. In fact, the first community-owned health plan that built out of our community is in Ashtabula, Ohio. And yes, it started with a private sector employer, just tiny 38 employees, but when the school district and then the city and then the county and people on the economic development board is like, oh my gosh, we sometimes talk about shop local. What's more local than an interaction between a doctor and a patient? Yet you take a community like mine, our county is about 250,000 people. So we're spending $3.4 billion if you take per capita spending all in across all ages on healthcare. At least $1 billion, probably closer to $2 billion extracted out of our local economy for a fundamentally local service. And so when people see that, like, oh my gosh, this is something that Yeah, we're employers too. We have budget crunches, and so we can address a pain we have. But if we can actually be a vanguard employer in our community, I'm having regular meetings with the mayor in my town. And it was interesting in the last election, it's probably 18 months ago or so, the newspaper crowdsourced, what do our readers want to hear about? And there was 5 issues. 2 of the 5 were about the local hospital. That tells you something about how important that is to communities. And so there's some really long overdue changes that I think this AI revolution, right? There can be some good things that come out of that. But most of the work in AI happening right now in healthcare is about gaming bills and making them bigger. And so let's use it for good. Let's use it to wouldn't you rather have somebody transform from an insurance billing processor to a community health navigator, or somebody who's a coach for a ball team? That literally can happen. And you think about the things that make our communities great. It's the arts, it's a cultural, it's a recreation. That's really what the Health Rosetta dividend about is: capture those wasted dollars, reinvest them. And I would just wrap up with every community has a river of healthcare money flowing through it. The source of that river of money is your pockets, my pockets. And though that river should work like a water cycle, instead there's these giant corporate pipelines that extract it out of our community and divert it. We have the ability to cut off those corporate pipelines, and that's what's happening. And I'm super excited when I see that, and it's happening more and more.
Dave, thank you so much for sharing all of these great insights and for joining me today, for everything you're doing to help fix healthcare at the root. So it's been inspiring to hear how Health Rosetta is driving real change for employers and their people. And I know I'm especially excited to attend RosettaFest this year as an exhibitor and a speaker on the power of root cause health benefits. We can't wait to be part of the conversation and connect with others who are building a better future for healthcare. With that, would you like to give a final call to action for how do people sign up for RosettaFest?
Yeah, just go to RosettaFest.org. And there's tickets for employers, there's tickets for clinicians. You can see who you are. And don't wait till the last minute and show up and pay there unless you want to pay more. You can get a better rate right now by doing that. We've had just incredible feedback. And we're actually in Denver, as I mentioned. 3 years ago, we were in Denver. The last time we were there, we had about 200 plus people attend. This year, we'll have 1,000. That's how this movement is growing. So that's really exciting. And I'm excited this can be your first time to a Rosetta Fest. So that'll be really cool. And I think you'll find a lot of like-minded people who aren't sitting around complaining about the old, just building the new. Frankly, the old is irrelevant in many respects once you get focused on building the new.
Yes, absolutely. Thank you so much, Dave.
Thank you.
Thanks for listening to Get to the Root. If you enjoyed today's episode, be sure to subscribe and share it with someone who's ready to rethink healthcare. You can learn more about Root Functional Medicine and our work with employers at rootfunctionalmedicine.com. We'll see you next time, where we'll keep challenging the status quo and getting to the root of what really drives better health.